to GW Entrepreneurship Week. We welcome you to our full-day conference. My name is Linda Achelanu, and I am a Senior Project Manager for Covance, the Drug Development Division of LabCorp. I am also the GWSB Eric K. Winslow Award 2020 recipient. I had the honor to host the 2019 GW conference at the US Congress. This is my second year emceeing the opening, and I'm so delighted to be here. I am a GW alumni, and as you can see, GW keeps their alumni very close, so I'm back. I hope you all are doing well and being safe. At George Washington University, our comprehensive and numerous entrepreneurship-related programs make us fortunate to have a wide variety of opportunities to foster collaboration and innovation. It is from here that we envision one major event, our annual GW Entrepreneurship Week. Together in one virtual space, we have the opportunity to create expansive change within and throughout the university and our surrounding community. This year, the week's theme is Resiliency. Being celebrated in a strategic moment in time, post-corona, and after a couple of months of school reopening, we have the unbelievable opportunity to share and learn how we can be more resilient. We will be talking with individuals who have been forward thinkers in the areas of creativity and innovation and dedicated scholars of GW. Let us start the opening session with welcoming remarks from the founder of GW Entrepreneurship Week and the GW Entrepreneurship Conference, Dr. Ayman El-Tarabishi, my mentor. He is also the originator of the UN Entrepreneurship Day, celebrated every year on June 27th. Dr. Tarabishi.
Linda, good morning. Thank you very much for kicking off the GW October Conference. And I appreciate you coming back, even though you graduated, you're coming back and giving to GW. So we are very, very happy that you keep supporting GW here. And for everybody joining us today, greetings from wherever you are around the world. I hope you are safe. And I am just delighted and honored to be here. I want to thank all the keynote speakers that have contributed their time to come to GW to support our GW Entrepreneurship Conference here. But in particular, and this is just for all of you here, this conference is special, especially in today's time and what is happening around the world with COVID-19 here. We at GW understand the challenges that everybody faces. But since the summer and even before that, and we worked hard to make sure that we are reaching out to everybody around the world to show that GW is part of a global family to support everyone through knowledge, to networks, to learning, to possibilities and opportunities here. So I am just delighted to continue this effort here on behalf of GW. And more importantly, and this is something just absolutely remarkable here, and I want to especially thank the GW students, right? They are in the midst of many crises here, but they have come back to GW to take courses, to continue working, to handle family, to handle employers, to handle everybody, and yet continue to be supportive. More importantly, and this is just remarkable, and this is a feat to all GW students here, this conference today, and what you'll see now and moving forward here, was designed, planned, organized by GW students. So what you see here today is the thought process, the hard work of all GW students in my entrepreneurship class, in my innovation creativity class, but also students across GW that have all jumped in and participated here. And this is remarkable. I think we are the only university that actually asks its students to run a global digital conference to reach out around the world. I know a lot of people are joining here, and this is just to showcase the best of GW, which is students. So I personally thank, and I'm honored to have all my students in all my classes for their hard work. I know you put hard work. I know you did way beyond than expected here, and I'm very thankful. I also want to thank the ICSB team that have worked with my students collaboratively to put this all together. So there's just this absolutely just remarkable, the synergies between organizations here. And finally, I want to thank the MBA office, Liesel and her team, and everybody in the School of Business and the university, and everybody across campus here that jumped in and supported GW Entrepreneurship Week. Today actually is our 4th day of GW Entrepreneurship Week. So we are just expanding more and more, and we had a whole week of events here. So this is just remarkable what we're doing here. So Linda, thank you. I look forward to seeing you next year, right? And I'm gonna give it back to you.
Thank you, Dr. Terabishi. Then let me warmly introduce Dean Liesel Riddle. Dr. Riddle is the Associate Dean of Graduate Programs and an Associate Professor of International Business and International Affairs at the George Washington University School of Business. Dr. Riddle has written extensively about diasporas and development, international entrepreneurship, and trade and investment promotion. Dr. Riddle.
Well, thank you, Linda. I want to thank you as a former student and now alum again for coming back and serving our vibrant GW community. And thank you, Professor Terabishi, for your leadership, your light that you bring to such an important issue right now for the world today, and that is resiliency in entrepreneurship. I want to thank all of you for coming here today and bearing witness and learning from this incredible community that we have here at GW. There's a reason why Princeton Review rates us as #1 in the DMV area, #25 nationally in entrepreneurship. And it's because of the innovation, the hard work, and really the community that we all are that underpins this movement at George Washington University. And I feel so honored to be a part of it. One of the things that's really special, I think, about the way we approach entrepreneurship here at GW School of Business is that we've started to really think about learning as building blocks that can be customized, stackable, flexible types of education. And a very big, important building block for us is our creativity, innovation, and entrepreneurship graduate certificate that Dr. Terabishi actually spearheaded for us, and that many of the students participating and organizing this conference are actually receiving. This certificate can be taken by any one of you that aren't GW students as just a standalone credential. It's 4 graduate courses. Those of you that are current students, if you are right out of undergraduate or finishing your undergraduate degree, you can actually take this as part of your master's in management. If you're a career switcher or looking to get that next credential to kind of take you to the next step in your career, you can come to GW and get an MBA. We have all kinds of formats of the MBA, but you can do this certificate as well. And for those of you that already have many degrees behind you, but do feel as if you've got a really innovative idea that you want to cultivate and take time out for that, or you just really want to upskill and reskill, we've created a really interesting Master of Interdisciplinary Business Studies, where you can take any 2 of our 24 graduate certificates, including the one on creativity, innovation, and entrepreneurship, and combine it for learning. So we are so grateful to have you here, and we hope to see you back in the classroom planning our next conference with us as well. Back to you, Linda.
Thank you, Dean Riddle. Let me now introduce our panelists. Today, we have 2 remarkable women who will be talking with us. I am honored and delighted to introduce a GW alumni and a blazing leader, Dr. Katia Passerini, the Provost of Seton Hall. Dr. Passerini received both her MBA and PhD from GW. Our second panelist is an outstanding and highly appreciated leader of GW. She is the founder of the GW Nursing School and one of our most appreciated contributors to our GW Healthcare MBA program. We watched her interview with Dr. Terabishi in our classes, and it's mighty and very humane. It just hits home. Dean Johnson. Dean Johnson is a Dean Emerita, professor of nursing, and a professional executive coach. As founding dean of the School of Nursing, she developed multiple programs, including one of the university's first online programs. This is a fantastic panel, which consists of only powerful female speakers. I am so excited. The theme of this panel is Technology, Wellness, and Society, Innovative and Unique Relationships to Build Resiliency in Our New Normal. The abrupt onset of COVID-19 pandemic made preparation and full comprehension of the expected changes nearly impossible to envision. Our new normal is full of changes in almost every aspect of our lives, and there seems to be endless bounds on ways in which every one of us have been effective. Reflecting on this, I remember at this time last year, we hosted this event with intellects from around the world at the US Congress. What has been so impressive is that due to the pandemic, we were still able to accomplish our goal, adapt, and host the event entirely online this year. And this goes with everything else that is happening around us. Healthcare turned virtual, schooling from home became the norm, retailers introduced new scaled methods, and everyone folded to the hand of technology as it evolved to represent the primary communication tool used to bridge our gaping disconnect. Creativity and innovation go hand in hand, as creativity is often a precursor to innovation. When we are challenged with unprecedented circumstances, we are challenged to change or alter our previous thinking patterns. So we're going to start the panel. Please post your questions in the chat and my team will cue them at the end. Each panelist will have 20 minutes and we will end the session promptly at 9:55 a.m. Let's get started with Dr. Katia Passerini. Dr. Passerini, you're on mute.
Sure. I'm trying to share my screen, so you don't need to listen to me yet.
Okay. So let me stop sharing.
Okay. I believe I'm now sharing my screen, right?
Yes, you are.
Fantastic. First, let me start with thank you for the opportunity to join the conference remotely. I try to join every year, and this is really an event that I look forward to. Last year, I had the opportunity to see the many students that Dr. Terabishi was speaking about before presenting their idea and innovative findings. So it was really delightful. So I'm glad to be joining this excellent group. Dr. Terabishi asked me to talk about resilience, and it's how art and creativity and innovation can help us through this difficult time. As mentioned, I work as the provost and executive vice president at Seton Hall University. So I'm going to talk about resilience in the context of education, which hopefully will sound close to you as well, because you're living a lot of the things that we will be discussing. So the title of this is The Current Disruption in Education and How Art Could Save It, or at least could give us some ideas on what to do next. So I'm going to start with citing my sources. Two reports I used here primarily to prepare this presentation. One is pre-pandemic, but a lot of what was said before the pandemic is actually very true and accelerated today. So there is a report from the Chronicle of Higher Education called The Future of the Degree and How Colleges Can Survive the New Credential Economy. So that's a big foundation of this discussion. And then a more recent report from Inside Higher Education that talks about college leadership in the era of unpredictability. In front of those challenges, what should we do at the macro level, and how should we respond? So I'll use this as a framework. You can certainly access those reports later. They're fantastic read if you have time. So the key points of this discussion is I would like to start very briefly talking about disruption, although we are all aware of what a disruption is, but I think right now it's been accelerated by not just one, but 3 pandemics. The health pandemic that we are experiencing that has also kind of pushed into an economic pandemic, and also an understanding that there is still, we have a third pandemic, which is that of systemic racism. And we saw that in the health sector when we also realized that the way COVID is impacting communities is also stratified by different social and ethnic background. How do we survive? Traditional models that we've always used are very difficult to adapt to situations that change and are accelerated all at the same time. So we need to start thinking about new models, and we need to start thinking about them not just incrementally, but at an accelerated pace. So we also need to think not just about new models for the university as a whole, but also new models for education in general that maybe might end up changing the way we teach. But it's interesting because we will see at the end that what I'm advocating for is actually a solution that comes from the past. So it's not a new solution. It's a solution that if we think about the arts and how the arts have worked over centuries, we might have an answer that is unique and that might provide an opportunity for some of the institutions that are struggling today or might struggle in the future to really find their own modus operandi. What you see here is a couple of pictures from the Divine Judgment in the Sistine Chapel. Just to, as a note to this is, as you know, the Sistine Chapel paintings, themselves were very disruptive. Michelangelo, when he did this painting, he had quite a quarrel with 2 different popes on the amount of nudity that had to be represented inside a church, but he was the disruptor. So for a few years, those paintings were covered with scarves, and then they were put back in their original form. So I think art is a great way to think about disruption and solving disruptions. So let me talk about the sign of disruption. Of course, nowadays, what we're seeing is online learning. It's been here for a long while. You're all students of online learning, but it hasn't been here at the scale that we're experiencing today. And at the beginning, we were very scared when we had to go online quickly. And now we're actually learning from our experiences this semester that it works, and it's working actually even much better than what we predicted. So this is going to disrupt our traditional models. The other thing that are going to disrupt us is the fact that employers are looking at learning in a different way. They're not really looking at degrees anymore, but they're really looking at competencies, and they're looking at a mix of experiences and learning. So the degree is just not enough anymore. You have to bring much more into the table in terms of credential. And the problem is that also degrees, to a certain extent, have increased to the point that obviously, as you know, being mostly graduate students in the MBA, the undergraduate, the bachelor is not the minimum common denominator. Today, the master is the minimum common denominator, and maybe soon even some higher level degree like a doctor program or professional doctor will be very important, because the jobs that we have in front of us become much more complex, difficult to adapt, and knowledge is really something that you need to continue to develop well beyond your degree. So we talk about lifelong learning, and as universities, we have to be prepared to provide a lifelong learning experience. Before you were mentioning the certificate, things like certificates, micro-credentials, and different types of degrees pathway are really important to continue to be sophisticated knowledge workers. I wanted to go back to the past one more time. I spoke about Michelangelo and the Sistine Chapel before. I want to talk about the fact that what we're seeing today in the education market is not new. If you think about the way that universities started, and I'm focusing here in the United States, they usually started the Ivies of today, the Harvard and the like, as really a cradle of intellectual humanities and social sciences reflection and work, theology, philosophy. That's how you went to a university, to the point that bachelor degrees that were more applied were considered really entry-level and vocational type of degrees. And you can see how that has changed completely and turned around today, where a degree in engineering or a degree in a professional field has an incredible high value, provided that you have a solid background in, of course, in the humanities and liberal art. Masters become the new common denominator, as I said. And then we have the phenomenon of the MOOC, massive online open courses. We thought they were not working, and in reality there are mixed results from the MOOC experience because they were online and massive and there was no personalization. But what we're seeing today, and the reason why much of the online learning that we're doing today is working, is because it seems to be customized to the learner. So now we have professors that, instead of being a one-to-many experience that it's detached and asynchronous, they're actually working synchronously with the participants. So there is a lot of more interaction. So this is actually a phenomenon that is not a fad anymore like the MOOCs, but it's probably here to stay and will force us to change and adapt. I want to say something that unfortunately it's not too positive for MBA students at the moment, but we have to recognize that these signs of change have been all over. And if we look at also at the enrollment in MBA programs, for example, over the last few years, they have been decreasing. And the reason for that decrease is related to the fact that there has been a growth at the master degree level for specialized competencies and specialized degree. So the MBA, that used to be the catch-all business education that prepares you for different positions, it's not sufficient anymore. It has to be highly specialized. So that's why it's so important that GW does it so well, to create a pathway or a concentration that really focuses you on the field and disciplines that you want to work on. A lot of the skills that you need today, they're not generic anymore. They're specialized to the field you want to go in. So in front of these changes, disruption, and decreases in the value of certain degrees, what can we do? Well, there are really two actions, and I think this is the part in which I want to talk about resiliency. You can be frightened and step back and say, this is not the time to change anything because we are in the middle of the pandemic and we don't know what we have next. And that's certainly an approach, and it will be prudent to see what happens after the pandemic. Or you can try to step forward, even if you're anxious and you don't know what the future is. And I think this is a better place to be, because what we have right now, it's the urgency of change. So you have a lot of momentum that, although we're dealing with 3 big crises, it's really an opportunity for us to rethink in an accelerated way about the future. So the way you have to do it, though, in terms of resiliency, and I'm living this every day, because every single day we tell the faculty to do something else, and then to do something else, and let's do program review, and then let's think about our structure, and let's think our pedagogy. It's a lot coming together. So one way of addressing this in order to be able to do it correctly is to do what hospitals are doing. Frankly, every time you enter a hospital today, even in the COVID case, the notion of triage, right? There are some problems that are immediate, they are urgent, so you need to address them. But you can also break them down into what you can manage right now. So what's urgent right now, what's medium, and what's long term. So which patient do you take care of first? So think about that approach in terms of the problems that you have to deal with. And the strategy is really, when you have something urgent, look at what is urgent, but also look at the long-term impact. So what's the larger goal? So it's really a balance between dealing with a small set of short-term and short goals, which are pushing your reaction because they're urgent, but always doing it within the framework of strategy. And what I'd like to submit is that this strategy, the way you make decision when you have every conditions changing in front of you, is really going back to what is your core mission. So if you're a business, what's your core mission as a business? So that's what will guide you all these reactions that you have to take at a single point in time. Or if you are at a university, for example, now that we're making so many changes at the same time, we went back to discussing what is our core. Well, at the first part of what we do is our mission, and our mission is teaching and research. But research is not a goal onto itself. We do the research to as a way to improve our teaching. So as a university, we decided this is our mission, and so what our focus is going to be is really the balance between those two areas. Going back to our teaching and research, and my specific university, we're also faith-based institution. So a lot of what guides our decision making is our the attention towards also the mission and the value-driven education and servant leadership that we have chosen to focus. The other item is the interaction with the community. So universities don't live by themselves, but they interact in a community. We interact daily with our West Orange community here in New Jersey because they're concerned about COVID cases, escalation of COVID cases. How are we managing those COVID cases? So managing this connection with the community are really the two key areas that we have decided to focus on. So every business organization will have an opportunity to find those long-term goals. But one thing that we're also considering is, in the middle of all this pandemic, are our long-term goals the ones that we should continue to sustain moving forward? And if you think about what we are discovering during this pandemic is that we have students who have issues of affordability, there are issues of access to technology. We have the technology, but can everybody access in the same way or use it in the same way? Is it empowering everyone in the same way if they have a background that is not ready for using this technology in the way that it needs to be used? And also we are reconsidering whether we've always been pursuing, and many universities do, this goal of prestige and exclusivity, because that's what brings you up in the rankings. But is this really the role of a university? Or should a university provide a public good and access to knowledge to anyone who not only can afford it, but is also willing to put the effort and the discipline to be able to get to the next level and be that knowledge worker that we talked about at the beginning, needs to understand very complex jobs. So we're also thinking maybe there is a way of evaluating university and ranking against each other based on affordability goals and student learning outcomes, more so than the selectivity metrics that we currently use. At the micro level, so not talking about university goal, but talking about changing within the university, we're also considering, is it time, and the faculty are asking me this every day, this iFlex method that we're using now, is that a new pedagogy, or what's the new pedagogy? Is this good, or should we have different ways of thinking about delivering instruction? So I wanted to go back to this model when we said that employers today think about competence more so than degrees, and degrees continue to be measured by number of hours that you sit in the classroom, but really should be measured by what you have learned. The employers are looking for a mix of experience on the job as well as in the classroom. And now we have an opportunity to do both, because with a virtual environment, we can also be doing our job and then completing our class online. As long as we have common standards of evaluation, we should be able to do that. Stanford has been experimenting with the concept of open loop learning, where students are not constrained anymore of finishing a degree within a time period, which is the way sometimes universities are measured, to time to completion of a degree. But the idea is within 6 years, you have a certain cost for your education, but you go in and out from taking some classes, going back to the job market, and then continuing your degree at a different time. And that could create, for example, a very nice mix of competence and experiential learning that employers are looking for. It's very important to be aware of these trends, because frankly, they could, especially as we go through more online learning and micro credentials and low cost online access to very high quality education, we could find ourselves in a scenario where we're competing against the entire world, right? If you think about Georgia Tech is now offering masters online in computer science and engineering, an area where they're really, really strong, for a fixed cost of $10,000 or $12,000. Now, if you're a student living in California, why not take your degree from Georgia Tech, which is known for technology, for that low cost? So what does your university, how does your university in California survive? How do you are you able to live in an environment and to thrive in an environment where competition now can come from anywhere in the world? And if we think at the structure of Europe master degrees, they're really at a cost level that is very different from the cost level in the US. So tomorrow we can think that a lot of US students might start taking master's degree online from anywhere from a European institution. So how do you deal with that? So I think we should go back and look at what we used to do when we were teaching and training artists to become the great artists that then they became. So there is the concept of the studio, there is the concept of apprenticeship, and there is the concept of the academy. So if you look at the way we used to learn, we really learned through a cycle that wasn't just the sharing of knowledge, but it was also the socialization and internalization of knowledge. This is a picture of one of the first universities in Europe in medieval times. And you see that the knowledge sharing is really the sage on stage, and then people connected and having a discussion on the material. And this is exactly what we learn. What we know is the process for learning. There is an aspect of learning which you see on the right side of this quadrant, which is all about creating a segment of learning, creating a video like the video that we're looking at today, or this discussion. You could record it, archive it, and listen to it later. And I could leave this discussion by thinking that everything that I said today, everybody agrees with it and has internalized it and is going to use it next time. But the reality is, no, you're just going to listen to it because it's been codified. But we need to follow up with a process of internalization and socialization, that it's what enables you to transform what you heard into actionable knowledge. So in medieval Europe, that's the process by which we learned. You see here the sharing of information for the socialization, so people-to-people interaction. You also see the codification. You need to record this this discussion, this presentation, or you need to write the book to be able to share knowledge. And of course, you remember the printing press and what that did to expansion of knowledge and alphabetization of the entire world. Combination, of course, you need to be able to create new knowledge by combining different sources. And in medieval Europe, theologians, for example, and magicians were the ones who were combining different types of knowledge. And then finally, internalization is the process of, again, making sure that what is being transferred is applied by the end user, adapted to their own context, and then used for additional action. So this process, it's what creates new knowledge. And if we go back into thinking about this process, I think what we will be able to understand is that we can't just find an online tool to deliver instruction. We need to find ways for people to get together. So what I would like to consider is there a way today for us to create environments in which we continue to be together in people-to-people interactions, so that we can really internalize and then socialize and make what we learn actionable? So I like to give you one example of where this is happening, and I think could be the future of how we reorganize the way we spend time in universities. Is the studio model that has been used in the arts and architecture for a long time. this model is very important, especially when you're dealing with threats of online education from all over the world, is because it's highly localized. It's not replicable, because its strength is really the co-location and the network interaction that you're able to create locally. So those are different architects that are thinking about designing, and they're getting continuous feedback throughout their process of designing. So what I think it's important here to remember in the way we will build instruction in the future is that we need to continue to have the people-to-people interaction, the interaction with the place, because all those spaces where these interactions take place have a lot of impact, the way they are designed and delivered. And then, of course, the role of technology, because you can have some of those interactions also virtually, but that shouldn't be the only tool. So here is an example of the people-to-people interaction from UC Berkeley. Again, architects thinking about the conception of the idea and the initial design, and the way the feedback in those desk splits usually happens. It's several hours of sessions and continuous going around the room and getting incremental feedback on how to improve the design. And then there is the connection with the spaces. If you look at a lot of architecture studios and art studios in universities, they look something like this. Every student is assigned a desk, that becomes their home, that becomes their connection with the space and with the other students, and they make it their own space. And they spend incredible hours and nights in the desk that is assigned to them. So they create the connection with the space. And then finally, we also have to think about the role of technology and how we use technology in the space. So this is an example from the University of Buffalo, where the students helped design a new public safety building, where they looked at how public safety was using cameras and surveillance cameras within the campus, and then they tried to create a space where they could use that technology but be more visible and look at the entire campus so in a way that it wasn't in the basement of some building, but it was more interactive with the environment. So what we need to do is to continue to study how we use technology, and then adapt our interaction, people and spaces to these uses. I think that if we do this, we will continue to provide that unique value proposition, that unique network, or that unique environment and presence that is still, and will continue, I like to argue, will continue to be very important in our future of education, and will also make us more unique, because I believe that while there is much to be learned through the online interaction, it's really those differences of experiences that you have locally that they'll differentiate you from your competitors in the future. So, and with that, I hope I've been within my 20 minutes. Thank you very much.
Thank you, Dr. Passerini. That was such an excellent presentation. I like how you were discussing the development of soft skills through art and the role of the university and how it will pertain to resiliency in the future. It's just really, really important. Thank you so much.
Thank you.
Okay, so next we will go to Dean Johnson and ask about her vision of the future. I know Dr. Terabishi has called to her to ask her the difficult questions, as he usually does. Dean Johnson, thank you for joining us. We're excited. Let me start sharing your presentation. And you're on mute.
It is a pleasure to be with everyone today. And I am so impressed that this is a student organized run activity. You know, this is just remarkable. And entrepreneurship is such an important topic. And, you know, Professor Iman Abishi has been wonderful to work with. I have worked with him for many years. Healthcare is about change. And change, even before COVID, I can guarantee you that the rate of change within healthcare has been so remarkable that resilience is absolutely required of almost any healthcare worker. We have experienced very significant burnout amongst health workers before COVID. And now with the pandemic, we are really, really challenging everyone. I wanted to talk about the influencers of change within healthcare, because all of these challenge us and challenge our ability to rise to the issues before us and keep improving healthcare and keep improving the experience of patients. And so I think about the influencers in several ways: through technology, big data, which is really artificial intelligence that is having a very, very major impact, consumer expectations, cost, changing workforce, and unknowns. So I'll begin with the technology. And the technology, we see a very steep trajectory in what is happening. We now have exoskeletons that people can wear, that have a lower limb paralysis, that they can walk. We have a Billy screen app that, you can look at your eye and they can, and this app can assess, whether your bilirubin is high, which is a very important precursor of pancreatic cancer. So it's an early detector. We have robotic health workers, the brain-computer interfaces that we're looking at in terms of healthcare is remarkable. And, the brain-computer interfaces will provide us the ability to actually manage much of our own care. The virtual reality, patients are using virtual reality for pain management. Clinicians are using it for education. We also have, and we're well into the device wearing monitoring, but that's just going to evolve even more. The wearables will be telling us not only our blood pressure, heart rate, sleep hours, those kinds of things. They'll be telling us what our blood sugar, levels are, and other kinds of chemistry assessments. Telehealth. Telehealth has been a possibility for many years now, and the pandemic has really moved us into the ability to use it and start using it wisely. And the big change in using telehealth wasn't just the pandemic, it was the Centers for Medicare and Medicaid paying for the telehealth visits. So we have these very big systems that influence even small things like doing, well, telehealth isn't small, but, compared to our financial and reimbursement system, telehealth is only a small piece. Within the technology arena, interoperability of systems. At some point in the not too distant future, we could be in the Middle East, we could be in Asia, we could be in Florida, we could be anywhere and see a health provider who will be able to pick up our data and know something about us. The interoperability systems right now are very clunky. Special programs have to be written. Outpatient centers don't, mesh with hospitals. So we've got some work to do. One of the very exciting areas in technology is the CRISPR. And I'm so excited that two women, were awarded the Nobel Prize in Chemistry. There was only one other woman in history that won the Nobel Prize in chemistry, and that was Marie Curie. And CRISPR is this amazing technology that can basically edit DNA. So you can identify areas within DNA that are disease related and through an enzyme essentially cut them out and you can replace it. So the CRISPR is used in cancer research right now and beginning in cancer care, but it has applicability to almost any disease that we experience. So moving on to artificial intelligence enabled through our electronic health records. We have a gazillion amount of data points, a gazillion. And what this artificial intelligence is going to do is help us better make clinical decisions. Any individual provider cannot sift through a billion points of data to care for a single person and come up with the care plan. but artificial intelligence can do that. It also just helps us manage the information. There were 4,000 articles printed in or available in May alone around COVID. And there is a program that has been developed through artificial intelligence to extract certain key pieces of information. It's also really useful in speeding up the drug development. We're seeing the vaccines fast-tracked. Some of how that is being fast-tracked is through the use of artificial intelligence and algorithms and being able to collect data in a very, very quick way. And this leads to the individualization of care. We will be able to tailor care to each and every individual rather than saying, oh, this drug will be used to treat hypertension when it's not going to be effective because of genetic reasons or, so the artificial intelligence, our biggest challenge is getting the algorithms right. And we know that there can be bias within how algorithms are developed. Also, consumer expectations. The next slide is having is a really important driving force. Consumers are wanting to focus more on wellness. We want to know what it is that's going to keep us healthy. And we want our healthcare providers to not only manage a disease or a health problem, we want them to help us keep us healthy. There is a really move towards what's called functional medicine. And functional medicine is more about the process of staying well than it is about the dysfunction of disease. Relationships with providers. Everybody wants their provider to care about them. They want them to listen, they want them to communicate, they want them to care. And with the technology impacts that we have, we've got to keep an eye on what consumers want from us. They expect that we as providers will be clinically capable, but they want us to have that emotional caring part in that relationship. Greater quality and affordability. The quality issue. We see so many disparities within healthcare and really trying to focus on it. One of the things that I'm really proud of in terms of healthcare is that we have recognized that there is systemic racism, that there is implicit bias in how we care about people, and we need to do better. We also need to make healthcare affordable. And when we get to the unknowns piece, I'll talk a little bit more about that. And the demand for non-traditional care, the alternative healthcare models, and also easy access. The models, the retail clinics were a very big disruption, to the established outpatient care where it was sometimes hard to get to and not convenient, but you can walk into CVS and be seen within 10 minutes. So, we're seeing a very big change amongst consumers. And then cost. Cost has been a driver of changes in healthcare for decades, as long as I've been in healthcare. The national health expenditure grew in 2018 by 4.6%, more than the inflation rate. And we now spend something like $3.6 trillion. And we expect to be spending about 6.2 trillion by 2028. And this is going to increase the percent of GDP for healthcare from 17.7% to 19.7%. The importance of that is that the more we spend on healthcare, the less we spend on education, on other public goods. So this is a really big deal. The Centers for Medicare and Medicaid have an innovation center that is specifically funded for $10 billion over a decade. And through the ACA will be, if we continue with the ACA, will continue to be funded at $10 billion every decade without having to go through an appropriations process. And their sole focus is to look at service delivery models that can save costs and maintain quality. So cost has been a big driver in innovation within healthcare, and we still don't have it managed. So workforce. Where are we on the workforce? Oh, on costs. I wanted to also show you that, go to the next slide, that the US spends more on healthcare than any of the other OECD countries. And yet, what we don't have is we don't have comparable outcomes. Our maternal death rate, is the highest of any of these countries. When you look at composites of quality as measured in these countries, we not only have the highest cost, we have the lowest quality outcomes. So clearly we have room. Other countries have managed to spend less and produce higher quality care. And we really need to keep moving in that direction. So now moving to the workforce. The workforce in terms of future roles, what I see is kind of a bimodal challenge in terms of what people will be doing. I think there will be a large group of healthcare providers focused on technology, focused on tests, focused on, the application of technology to disease management, but also to wellness. I also see a coach interpreter role, because with the artificial intelligence that can probably make a better diagnosis and create a treatment plan for a patient than an individual provider, say in an outpatient clinic, I think that providers in outpatient clinics will really become more coach interpreters. That they will help people manage their illness, they will help people stay well, and they will interpret the findings. So I really see, the technology kind of coach interpreter roles as being very different. So one of the big challenges for healthcare providers is work-life balance. Every study that has been done recently on workforce is the biggest concern is work-life balance. And this is what sends people into being burned out in what they do. They can't take care of their kids. They can't take care of themselves. That the demands on them, with 15-minute appointments or, caring for patients with COVID intensive care units for 12 hours, sometimes 14 days a week or 14 days in a row, is really challenging. We're also seeing the feminization of healthcare, which is a very interesting phenomenon. There is, for the first time in 2019, there were more women admitted to medical schools than men. Within the physician assistant realm, initially a lot of med techs that had been in the Vietnam War came back and became physician assistants. So it was primarily male. But today, 74% of PAs are female. Almost 70% of physical therapists are females. And 88% of nurses are females. So we're really seeing, that healthcare is shifting. Nursing has always been female, but the other professional areas, we are seeing a shift. And so what we don't know is, will this actually become a more caring, approach to healthcare? Will salaries go down? Because there are a lot of pieces of the feminization of healthcare that we don't know exactly, what's going to happen. And then we also see changing traditions of education. For instance, where admissions to medical school, was based on GPA and how you did on the MCATs and, those kinds of things. We're now looking at ways of, so how can we recognize that perhaps that is kind of a biased way of admissions? How do we create a more diverse healthcare workforce? And it's interesting because in medicine it is, and nursing and all the professions, how can we have within the profession a reflection of the race of the patients that we're caring for. You know, how can we create the diversity that we really need in these professional areas? And you know, one of the other changing traditions within education, in addition to the admissions, is, you know, some of the sacrosanct things about having to dissect a cadaver, you know, is now kind of going by the wayside because of the simulations and everything that can be done that is actually such a better way of educating people, to be honest. So we're seeing a lot of changes. The use of virtual reality, the use of simulations, you know, a lot of technology. So now getting to the unknowns. COVID-19 and infectious diseases. I mean, actually, we kind of knew, you know, that we were at some point going to be experiencing a pandemic. I mean, we have been lucky in terms of, in some ways, that the Ebola outbreak did not spread around the world. And a lot of it had to do with how it had been managed. But, you know, the COVID-19 anticipated, you know, by many, and there will be others. And we're going to really have to figure out ways of how to manage better. You know, some countries have certainly managed better. So the Affordable Care Act, at least in the US, and I realize that there are people in other countries, you know, listening, that we don't know what's going to be happening, you know, with a major chunk of our health system. You know, our Supreme Court is going to be hearing a decision that could wipe it out. And then what? You know, there is not a plan, you know, beyond that. And then we have other policy decisions. And for any country, and the US at the moment, you know, whoever wins the election, the policy decisions around healthcare are going to be probably different. And we will have to be resilient either way and move forward, keeping in mind that we need to provide healthcare to our entire nation. Conflicts and war. We don't know exactly, you know, when conflicts may erupt and what exactly will happen. And we also, one of the increasingly unknowns is the assault on the integrity of data systems. We have seen ransomware affect, we just had a situation with United Health Services that ransomware basically shut down their information systems, you know, for quite some time. And that is a very dangerous assault, and how we can manage and prevent that. So those are the big kind of changes that I see in healthcare. And thank you very much for your attention. And I wanted to put a little smiley face there just to end on a happy note, because we're all going to need to pull in all of the resilience that we have to get through this pandemic and our life challenges.
Thank you so much, Dean Johnson, for a powerful presentation. As an innovative thinker, you really touched on some very key points in healthcare in the future. And as always, you've always been ahead of the curve. Thank you all so much for joining us. This has been a great discussion. We're going to end the session, and then we just need you to go back to the main page and pick between two exciting sessions. See you soon. Thank you again. And please make sure you vote on Tuesday. Thank you. Bye.
Bye.
Bye-bye. Thank you.